Hello, I'm Dr. Jim Greenberg, inventor of Cystosure. Cystosure was designed to make female cystoscopy safe, simple, and standardized. As with almost everything in life, little tips and tricks can make using Cystosure even better.
Immediately after removing Cystosure from its sterile packaging, remember to close the cap on the blue inflow port. And, if immediate drainage of the bladder is not planned, plug the yellow outflow port. Otherwise, connect the Urobag to the yellow outflow port. Cystosure is inserted through the urethra into the bladder just like any standard urinary drainage catheter. However, unlike a regular Foley, do not fill the balloon with more than 5 cc of fluid. This will make visualizing the bladder trigone easier when the cystoscopy is performed. When it is time for the cystoscopic portion of the procedure, remember these key steps. 1. Clamp or plug the yellow outflow port. 2. Instill fluid through the blue inflow port using either catheter tubing or IV tubing with a Luer lock connection.
It is helpful to keep the roller clamp sterile and closed and close to the irrigation port for better control.
3. This is important. Most procedures for which Cystosure will be used involve some dissection around the bladder. This can lead to blood and debris in the urine that can cloud the field. Irrigating the bladder prior to insertion of the cystoscope can greatly improve the quality of the visual field. With Cystosure, this is easily accomplished by filling the bladder with 100 to 200 cc of fluid and immediately draining out by unplugging or unclamping the outflow port. Then, reclamp or plug the outflow port and refill the bladder with 200 to 300 cc of fluid, and you're ready for the cystoscopy. 4. Pre-lubricating the shaft of the cystoscope with a water-soluble lubricant prior to the insertion into the catheter makes inserting the cystoscope even easier. 5. In most patients, when the cystoscope is inserted to the hub of the Cystosure catheter, the tip of the 70-degree cystoscope will be positioned directly over the trigone of the bladder. Inserting the cystoscope with the light source up and the 70-degree lens pointing down will make immediate visualization of the trigone even easier. From this position, a simple 30-degree rotation of the cystoscope will make identifying both urethral orifices easy almost every time. 6. Occasionally, the edge of the catheter will appear in the visual field. Gently pulling back on the shaft of the catheter will quickly and easily resolve this problem. If properly placed, Cystosure will drain in a similar manner to a traditional urinary catheter. However, if proper drainage seems impaired, following these 3 simple troubleshooting steps should quickly and easily resolve the issue. First, check the outflow port and tubing to make sure there are no kinks blocking the drainage. Second, Cystosure, like any urinary drainage catheter, relies on gravity to properly drain the bladder. Catheters taped high on the thigh or draped over a leg can rarely accumulate pockets of air that can impede drainage. Lowering all the components of the catheter system below the level of the bladder should resolve this problem. Finally, if the 2 prior steps do not improve drainage, gently flush the catheter through the inflow port to dislodge blood clots or debris that can be blocking the outflow.
We hope you find Cystosure safe and simple to use. With time and experience, we are confident it will become a standard in your practice. Thank you.